Good afternoon, Elder Justice Warriors. It is wonderful to see you back here in April. My name's Nicole Howell. I'm the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda, and we appreciate you making the time to come back and learn with us today. We have a couple tools we like to remind you of, which is first of all that we are an interactive program. So we encourage you to type your questions in the Q&A or the chat, whichever works best for you. And I'd like you to get started today by taking your cursor over to that chat, introducing yourself, tell us who you are, where you're from, and what you do. This is a great tool to connect with other colleagues, and it helps us to remember, especially during this time, that we are not alone. We are on the front lines with other people as well. As a reminder, we do make closed captioning available. Just select the icon on your toolbar. And thanks to California Department of Social Services, we are also pleased to offer ASL interpretation. We meet here every third Thursday of the month. We will be meeting again in May and then closing out our first year in June. But fear not, we are going to be continuing into the 21-22 sort of elder justice year, and we are working on an exciting slate of speakers to bring to you. So thank you for being part of our community. As a reminder, we do have several partners that make this possible, chiefly Kaiser Permanente. We also have several critical planning partners like California Department of Social Services, California Commission on Aging, California Long-Term Care Ombudsman Association, Office of the Long-Term Care Ombudsman, California State Association of PA-PG-PC, and California Department of Aging. Now, I am thrilled to bring on an elder justice warrior today that is renowned and is going to talk to us about fraud prevention and education programs. It is Micki Nozaki. She is with California Health Advocates, and she is a leader in the field, talking to both consumers and providers like all of you. And so with that, I proudly turn it over to Micki. Micki, welcome to the platform today.
Thank you so much, Nicole. Hi, everybody. You know, I want to thank you all for this opportunity to share some information about our ongoing fight to protect beneficiaries from fraud and abuse so that they can live safely and preserve their well-being. You know, for years, we spoke about the billions of dollars lost or stolen to the Medicare Trust Fund. And although we do very much care about the solvency of Medicare, it's time we recognize that beyond the monetary implications, healthcare fraud and abuse jeopardizes the safety and the welfare of our older adults and persons with disabilities. Now, in support of this position, let's move to the next slide. I share with you a study published last year and conducted by researchers at Johns Hopkins, which clearly correlates the treatment by fraud and abuse perpetrators, that is, bad doctors who billed fraudulently year over year and ultimately were removed from Medicare. The study ties the treatment by those fraud and abuse perpetrators to the patient's poor health outcomes, and in instances to their deaths. Many of the bad doctors who were studied were guilty of things like practicing with suspended licenses, improperly dispensing opioids, performing and billing for unneeded medical procedures, using untrained help, cycling patients through hospitals and nursing facilities, all to maximize their revenue at the expense of these unfortunate souls who were their patients. And you can see here from the slide, the conclusions of that study are disastrous. The study looked at tens of thousands of Medicare beneficiaries and concluded that the patients who were treated by abusive providers were up to 22% more likely to die and up to 30% more likely to have to be rushed to an emergency hospital within 12 months of being treated by that bad doctor. Moreover, and tragically, the researchers identified almost 7,000 patients who died during that study year, almost certainly as a result of the exposure to the fraud and abuse perpetrators. Further, and I'm sure, no surprise to you guys, many of these victims were disproportionately minority, disabled, and low-income Medicare, Medicaid beneficiaries. And this study fully supports prior research showing that ethnic minority populations and low-income patients are much more likely to use lower performing healthcare professionals. And as a sad result, much more likely to be harmed by this exposure. Next slide. Now, unfortunately, we have many, many examples of this type of abusive behavior, and I'm going to share a few here. The man on the left-hand side of your screen is Farid Fatah. He used to be a hematologist, oncologist. He had a medical empire in Detroit, Michigan. But over the course of several years, he administered poisonous chemotherapy drugs to patients who did not have cancer. He even gave cancerous poisonous chemotherapy drugs to people who were in remission. That's how hungry he was for reimbursements. His abuse caused untold pain and suffering. Many of his former patients still living with the result of his abuse. And unfortunately, in at least 2 provable cases, his abuse led to the deaths of patients. The man on the right-hand side of your screen is Salman Melgen. He was a retinal specialist from the state of Florida. He overbilled Medicare millions of dollars for a macular degeneration drug and falsely diagnosed many of his older patients with serious retinal diseases. He outright lied to them solely to be able to administer these torturous laser procedures to their retinas and fraudulently bill Medicare for over $70 million. Just 2 unfortunate but very egregious cases of healthcare fraud. Next slide. Another unfortunate case. This is about a CEO of several pain clinics in Michigan and Ohio who, over the course of many years, recruited some of the most vulnerable patients from homeless shelters and soup kitchens. Those people may have had legitimate pain. Many, unfortunately, were addicted to opioids. Some were drug dealers just looking for their next fix. All of them were perfect victims to be subjected to this guy's corporate policy. A policy which simply stated, if you want the drugs, you have to submit to these back injections, whether you need them or not. And why? Well, to quote Willie Sutton, he robbed banks because that's where the money is. Well, with Medicare, that's where the money is. The back injections he administered were the highest paying category of injections reimbursable by Medicare. And if one injection pays, well, why not do multiple injections to the same unfortunate souls? Pays a whole lot more. And so many of the patients had so many injections, they were left with holes in their backs. Horrible screams were a daily occurrence in his clinics, but they sure got their share of oxycodone. And the perpetrators, they got millions of dollars. Sad but true. Next slide, please. I think many of you understand any and all Medicare or Medicaid benefits can be abused by fraudulent providers. But today we're only going to focus on two of the most prevalent fraud schemes in the country. Number one, hospice fraud, deceptive hospice enrollments, and two, COVID-19 scams. And you can see here by the headlines that these fraud schemes are highlighted in mainstream media because they're so widespread. They're so common. They're so lucrative. Take, for example, deceptive hospice enrollments. There are so many hospice agencies throughout the country. There are over 400 hospice entities just in Los Angeles County. That's almost as many hospice agencies as in the entire state of Florida. In fact, we're told that in parts of Los Angeles, there's a hospice agency on every corner. Why? Because there's so much money to be made. Next slide. So much money. The majority of hospice entities are for-profit tax status. And the unfortunate souls who are lied to, who are promised groceries and bus coupons, even hospital beds. And I don't know about you, but it is very difficult to legitimately get a hospital bed. But these fraud perpetrators, they'll promise you anything. And the people who are promised these things, they don't know any better. They don't know that there is no new Medicare hospice program where you don't have to be terminal. And so ultimately they believe in the tricksters and the fraudsters. And what do? They sign forms, paperwork that they don't read, they don't understand. And what it does is it enrolls them in Medicare hospice. But the fine print says, if you sign into hospice, you waive curative care. And this is the most shocking. The unsuspecting people don't understand this. So as a result, we get so many calls from older adults who are so deceived. And now they're denied the health care benefits that they deserve, that they paid into. They don't know where to turn next. They can't get their medications. They can't see their doctors. Imminent surgeries are denied or rescheduled because when they call us, we have to unravel the mess that these fraudsters and criminals have gotten these poor people into. And believe me, it takes a long time to get them out of Medicare hospice and into the right place so that they can get the health care that they desperately need. Here's just a few examples of the individuals who call us and say, I don't understand what happened. I went to the pharmacy, I can't get my medications. Another gentleman was forced to pay out of pocket, something that he cannot pay out of pocket. But he has to if he has to get that leg brace because he's on hospice right now. And Margarito, poor Margarito, who only speaks Spanish and was tricked into signing paperwork, and now his heart surgery has to be canceled or rescheduled. Important heart surgery. But right now the surgeon won't do it because he shows he's on hospice. Next slide. And I think that Medicare hospice fraud is one of the most tragic of the fraud schemes. Medicare hospice is meant as a blessing to terminal patients. It provides them with the comfort in their waning days. But Medicare hospice pays well. And unfortunately, it is subject to wide-ranging fraud. Here's another terrible example. The CEO of a Texas hospice chain, for almost 10 years, he got away with the practice of going from senior apartments to memory care centers to nursing homes all throughout the states. And he recruited vulnerable patients with Alzheimer's, forms of dementia, people with limited mental capacity. He outright lied to them. He convinced them that their illnesses were terminal, even though they weren't. And he had them sign paperwork which ultimately enrolled them in Medicare hospice. And I'll tell you, he went to great lengths to persuade these unsuspecting folks. He sent chaplains to their homes on the false pretense that they were near death, so that the chaplains could discuss last rites and preparations for their imminent death. Other patients who were terminal, he kept on hospice for years, even though hospice is only meant for a few months. And what did he do? He subjected these poor people to surgeries and other medical interventions totally inconsistent with hospice, all the while making the CEO and his cohorts millions of dollars in reimbursements. Next slide. Horrible stuff. What is the solution? How do we combat this form of elder abuse? Well, one way together we can fight fraud and abuse is by spotting something suspicious and reporting potential fraud. In California, our Senior Medicare Patrol receives about 500 complaints a year through our hotline. Many complaints, as you would imagine, come from beneficiaries themselves, their families, their caregivers. Many from Medicare counselors who see people or talk to people every day. And many complaints from an assortment of professional advocates like yourself, long-term care ombudsmen, adult protective services, elder law attorneys, and other senior advocates. And we appreciate every single one of those reports. Because if you think about it, you know, we're all eyes and ears, right? The boots on the ground, so to speak. So allow me to just plant a seed here. Recently, I was speaking with a veteran ombudsman who has in the past reported potential fraud schemes to us. And during our recent conversation, she shared a couple of scenarios. She had done a couple of RCFE reviews, and she spotted at least 2 residents in 2 different facilities in somewhat suspicious circumstances. One gentleman was 81 years old, and it started out that he had a complaint that the caregiver had taken away his television remote, and he was not happy. Well, it started out just as simply as that. But the more she looked into, the more she questioned, with his family's permission, she noticed other things that looked not quite right. For example, the resident was diagnosed with Parkinson's, MS, and cardiovascular disease, none of which he had. And furthermore, he was on Medicare hospice. And according to his family, definitely not terminally ill. And then she told me that at another residence, she noticed similar circumstances. Same 3 diagnoses, the same hospice enrollment, and this guy was not terminal either. And they were both seen by the same doctor. Both people on hospice, both diagnosed by the same doctor for illnesses that apparently they didn't have: Parkinson's, MS, cardiovascular disease. And when she researched the doctor, she found out that he was on probation due to the abuse of controlled substances. And thanks to this ombudsman and her reporting these cases, both of these cases were referred on for investigation. And that's what I'm trying to say here on this slide. The more we educate, the more fraud is detected, the more we have the ability to report. And we in Senior Medicare Patrol are in a position where we take these cases seriously. We work with all of the myriad of contractors working under the umbrella of Medicare, and ultimately, with relevant information, refer these cases on to law enforcement. And boy, I'll tell you, the Inspector General and the Medicare contractors that do program integrity, they take these cases very seriously. These investigations do pay off. Recently, the Medicare program integrity contractors that we work with told me they were doing a review of several Los Angeles County hospice agencies. And after doing medical reviews on thousands of claims from the hospice agencies, they were able to deny 90% of the claims before they were paid due to error or abuse. Believe me, reporting does pay off. So wherever you may be, if there's a hint of something suspicious, let's say there's a hospice binder by someone's bedside when you absolutely know they're not terminally ill. Let's say that you see medical equipment, walkers and canes and all sorts of equipment taking up the whole room, but you know that they're totally unnecessary. Let's say a client tells you that someone asked them to sign paperwork, but they have absolutely no idea what it means, and they really don't know what they've signed or what it's gotten into. It could be any one of many different scenarios. Because when we get a report that appears to be fraud, we work so closely with Medicare and the contractors. And when we collect relevant information, refer those cases which could be investigated further. So planting that little seed that you can share this information with us anytime you see something that looks maybe not quite right. Next slide. And this collaboration I'm talking about, well, it's already proved successful. In fact, in 2020, of the hundreds of cases that we've referred to law enforcement, we got a report recently from our investigators showing that 16 of those cases were seriously investigated back in 2018 and 2019 and found to be ripe with fraudulent billing. They reviewed thousands and thousands of claims from these cases, and they concluded that there was evidence of false claims and that the government had overpaid them for things that they should not have. And now they're expecting to recoup almost $9 million from the fraud and abuse perpetrators because of their investigation, because of the cases that we sent to them. And of the $9 million in restitution, $2 million of that are from cases that originated from our partners. You guys, including long-term care ombudsmen in Riverside and Los Angeles. The cases were involving long-term care ombudsmen who actually identified providers recruiting homeless people, putting them in hospitals, moving them over to skilled nursing facilities and back again, all to milk home health and hospice benefits. In another case, Riverside County long-term care ombudsman reported that there were doctors refusing to release fully rehabbed patients from hospice or enrolling non-terminal patients in Medicare hospice. Yeah, those cases we take seriously. We took down all that information and we referred them on for investigation. And here you can see a successful recouping of millions of dollars. So I want to thank our partners and all of you, because we all have the ability to identify those suspicious cases. Next slide, please. Now, moving on from hospice fraud to COVID-19 scams. You know, I know that you guys know this. For years, our communications have evolved to online media. In fact, a recent study found that 72% of American adults have used social media platforms. And that percentage has stayed pretty consistent over the past few years, but has increased significantly during the pandemic. The internet is pervasive. It's ubiquitous. And especially during this pandemic, while folks are hunkered down in their homes, relying more and more on services through Amazon and others, connecting only by Facebook and Instagram. So of course, that's where the criminals now live. And the thing that makes my blood boil is that the burden of protecting yourself and themselves is on the older adults and persons with disabilities. Even for the technically proficient, it can be very challenging. Think about then those people who have limited English proficiency or lower financial literacy or early onset dementia, or even those people that innately trust others. Unfortunately, they're the ones that are the victims in this online world of scammers and fraudsters. Our investigators have shared with us that over the course of 1 year, since the pandemic stuck, they've discovered over 96,000 malicious websites. 96,000. Things like Moderna TX, Regeneron Medicals, Remdesivir. You've heard these things, so is everybody else. These words are recognizable because we hear them on the news all the time. So how can we fault people that are tricked and lured to the phony websites? And these phony websites, they're meant for one of two purposes. Either unlawfully collecting personal information, including credit card information, or deceiving people into purchasing tainted or lethal products such as hand sanitizer made with poisonous methanol. And ads on the dark web. We have been notified by the investigators that there are ads on the dark web offering $4,000 for a shipment of empty vaccine vials. Empty vaccine vials. What are they going to be used for? inserting something like maybe a saline solution into the vials and then selling them for $200 a pop as a COVID-19 vaccine? Well, that's what the investigators found when they looked at a phony Moderna vaccine website. That website was so well done. The logos, the colors, the fonts. It was almost impossible to discern whether or not it was real. It makes you wonder how many of these counterfeit COVID-19 vaccines were purchased by unsuspecting people frantic to get the COVID-19 shot. And if you think that's far-fetched, well, it's really not. Now, just as an aside, and a little bit of pop culture, there was a recent episode on a television show. It's called Chicago Fire, and the plot was actually taken from real life. The story was about paramedics, and these paramedics who were called to several accident sites where they needed to minister to the victims of accidents, people in horrible, horrible pain. And in one instance, the EMTs came upon a man who had an industrial accident. He was bleeding profusely from a leg injury. He was in excruciating pain. So she gave him a fentanyl shot, but his pain did not subside. So she gave him another fentanyl shot, and then another. And after 4 fentanyl shots, the poor guy was still in agony. And the EMTs, they couldn't figure out what the heck was going on. Well, the story finds out that they discovered that while the EMTs were called to an accident site, they were administering to the victim. The criminals followed the ambulances, got into the back of the ambulances, removed the fentanyl vials, and replaced them with vials with saline solution. Crazy, huh? But really, it was based on actual occurrences. So not so far-fetched that empty vials are in demand and used by the criminals to sell what they purport to be COVID-19 vaccines. Going back to the online surveys. Oh my gosh, I don't know about you. It's bad enough when the legitimate companies send you a survey right after a one-time business transaction. It's impossible for people to tell the difference between a legitimate survey and a phony survey. There's a new Pfizer vaccine survey flyer going around on email and text, trying to lure people into a website, offering them a reward of $90 if they will take the survey. Clearly a scam, but clearly something that people will fall victim to. And then, of course, we tell Medicare beneficiaries, Medicare will never call you. And then we find out that Medicare is doing a beneficiary satisfaction survey. But we encourage people to participate in the census, but protect their privacy. And then we hear about a legitimate United States Census survey. What are people to believe? How do we protect people? And if that's not bad enough, let us not forget the misleading television ads. Widespread and inescapable ads, especially during Medicare enrollment season, using very recognizable personalities like Joe Namath, hawking hundreds of dollars worth of savings. Just call the 800 number. We'll put you in a health plan. Might not be the right one, but we're happy to do it. It's really disturbing when we receive the frantic calls from the beneficiaries who unknowingly signed up for a health plan based on misleading ads. And then they discover that their longtime primary provider is not in the network that they signed up for, or the formulary for the new plan doesn't cover their medications. It's disturbing and it's frustrating, especially when we know that there are alternatives to obtaining the accurate, timely, unbiased Medicare coverage information. Next slide. Where do we get this local, free, and unbiased information? From the SHIPs and the HICAPs, the state health insurance programs, in some states known as the Health Insurance Counseling and Advocacy programs, where people can get free information, local information, and most importantly, unbiased information about all things Medicare. Information from trained counselors that don't have any other agenda other than to assist people in making independent and informed choices about Medicare. Many times in face-to-face counseling sessions, now available by telephone, of course, until things open up again. And here I've given you the contact information. In California, there's an 800 number to reach the 25 HICAPs. And out of state, every state has a state health insurance program, and you can find your state program by going to the shiptacenter.org website. Next slide. And speaking of resources, the Senior Medicare Patrol program. The program is in every state in the country and the 4 territories, a national program that allows organizations to be awarded grants from the Department of Health and Human Services. The primary focus of the program is to educate throughout their state about the risks to beneficiaries from fraud and abuse. They maintain a hotline for complaints and scam reports. We provide training on how to read medical statements and research assistance if there are questionable entries on Medicare summary statements and explanation of benefits. We also offer regular webinars on Medicare and Medicare fraud, and always publish fraud alerts when we see something that is prevalent in our state or across the country. And many of us throughout the country publish these fraud alerts in different languages to accommodate diversity. And here I've given you the California contact number for the California Senior Medicare Patrol. And in your state, if you're outside the state of California, the national number so that you can contact your state's Senior Medicare Patrol. Next slide. So let me conclude, first of all, by thanking you all for the services that you guys provide to older adults and the disabled. And I also thank you for your attention today. It's really a call to action. I'm asking that you stay current about the threats to our beneficiaries. And education is not a one-time thing. We need to institutionalize awareness, because we know that when people are aware of the risks, they are much less likely to fall victim to the scammers and the fraud perpetrators. And I also encourage you to partner with us. Invite us to do this training for your own organization. Share our fraud alerts. Every one of us can do something. And I want to point as an example the article I have here on the right-hand side of the screen. It's an article that was published last year about a taxi driver in Sacramento. And this taxi driver picked up a 92-year-old woman, and the woman was frantic. She told the taxi driver that she had to be rushed to her bank. There was no time to lose. She had to get to the bank and withdraw $25,000 from her account, pretty much everything she had in her savings. And she told the taxi driver that she had to do this because she just got a call from the IRS. And the people on the phone said that she owed $25,000. She was in arrears, and she better get that money today and send it over or face prison time. She was scared half out of her mind, and she pleaded with the taxi driver to get to the bank quickly. Well, the taxi driver listened to her story, and he tried to convince the 92-year-old woman that, you know, it sure sounds like fraud to me. She didn't want to hear it. She was so positive that she needed to get that money to them ASAP. But the taxi driver was, well, yeah, he was a little pushy. And he said, you know what, I tell you what, let's take a side trip. And he drove the woman to the local police station. And between he and the local police did some research and absolutely convinced this woman that she actually was the victim of a scam and that she didn't need to take out her life savings. Like I said, one person at a time, and we can do this together. So I want to thank you all. Thank you for kind attention. Thank you again for partnering with us, for listening to all the information that I have. Here's all my contact information. I'd love to hear from you. Thanks a lot.
Micki, thank
Nicole, turning it back to you.
Well, you're not off the hook yet. We've got lots of questions for you. I want to thank you for such a thoughtful presentation. I certainly learned a lot. I know we're seeing a lot of questions in chat. First of all, I want to remind everyone that not only did Micki provide her contact information, but we also dropped the Senior Medicare Patrol, their phone numbers in the chat. So be sure to pull it from there. We'll also be emailing out the PowerPoint and the recording early next week. So you will get all of this information. So I want to start out by, you talked about sort of your investigators. Can you tell us who those people are and what kind of training they have?
Absolutely. So there's a difference between what we do and what the real law enforcement investigators do. So we're trained in Medicare. In fact, there's two of us on staff that do this, and both of us were Medicare counselors. So we're licensed. We went through a lot of training about Medicare and the benefits. So we understand the coverage side of things. And we also have been to an awful lot of training about the current fraud trends, how the perpetrators do what they do. So when we get information from somebody, either a beneficiary or an advocate, we do research. We look at the Medicare statements. We look at the explanation of benefits. We collect all the relevant information to make a really robust case. And then we refer it on to the Inspector General from the Office of Inspector General from the Department of Health and Human Services. That's our main contact for law enforcement. Now, those are the guys that do the investigations, and they absolutely go out to sites with bulletproof vests and guns, because they're the ones that actually pull in those bad guys and throw them in prison.
You know, Micki, I feel like you're like an ombudsman and kindred to my heart, because no one gave me a badge and a gun, but we have people behind us who can do that if necessary. So I feel a kinship with you right now. Yeah. We have a lot of good questions around hospice, because as you know, aging and certainly passing is a really understood stage of life, and not folks aren't always clear what their rights are and what we can look for. So can you tell us what are the markers of a good hospice organization, and what should we look for in that enrollment process?
Sure. Yeah. And you're right, Nicole. You know, we are all aging. And in fact, I heard a statistic just the other day. A gentleman was talking about financial fraud. Now, listen to this. In the world today, there are 570,000 centenarians, 570,000 today. By 2040, they're expected to grow to 3.7 million centenarians across the world. So we all are getting older. And unfortunately, we've got the money, and the criminals know that. So from a Medicare perspective, what's difficult and what we find time after time is that the layperson does not understand the ins and outs of Medicare. Medicare is huge, and it's complex, and it's a whole bundle of rules, sometimes change every once in a while. So it is difficult for the layperson to understand. That's why they're so easily tricked. Hospice is one of those benefits that, like I said, is such a blessing to people who really need the benefit, who are terminally ill, who are expected to pass within 6 months. And those individuals who are terminally ill, they have to be certified by doctors in order to get legitimate hospice benefits. Well, unfortunately, those bad perpetrators, you know, they collude. So it is easy sometimes for the bad guys to just sign off when they know they shouldn't. Now, there are certain ways that people who don't quite understand Medicare can do some research on their own. Medicare does have listings of comparisons, doctors, hospitals, even hospice agencies. And those compares are online at the Medicare.gov website. But I wouldn't just look at the comparisons. I would talk to people. I would talk to the healthcare professionals that you trust. Go to the hospice, talk to the people, see what kind of documentation they provide, what sort of services they offer. You have to do your research. It's not an easy thing.
If I could add also, if you are someone who is also in a long-term care facility, or your family member is, and they're absolutely permitted to still receive hospice services, if that facility says we only work with X hospice agency, that is not appropriate. You absolutely can choose what hospice agency you feel the most comfortable with. So I always think it's a good idea to beware in any scenario, buying a car or receiving hospice, whatever it may be, beware of the marketing around it. Make sure that you are absolutely comfortable with what you're receiving and have the right to ask any and all questions.
Well said, Nicole.
So we have another question from our colleague, Randy, up in Sacramento. He's a good ombudsman up there in PSA 4. And he talks about, where is the line between palliative care and hospice care? And how can consumers know, can they be on hospice indefinitely? Sort of what is that timing? What does that look like for folks?
It's a great question, Randy, and I'm not an expert on it, so I'm not going to really pretend to say that it's in my wheelhouse. I can tell you that as part of our Senior Medicare Patrol program, we bring in those trained, educated speakers that know about these things. In fact, in March, at the end of March, we brought in the executive director of the California Palliative and Hospice Care Organization, and she told us everything we needed to know about the differentiation between palliative and hospice care. And let me tell you, it is confusing. Not only that, but there are regulations that have been put forth, and we're hoping, with our fingers crossed, that many of these regulations can be passed because they understand that we're in a serious situation right now, and we need much more oversight, much more monitoring. So it's a good question, but we know that there are experts out there that can tell you all of the information that you're looking for.
Mhm. And I think you picked up right where Bob, he's a tremendous advocate for Alzheimer's Association. He actually asked, you talked earlier about Department of Health and Human Services. What kind of support or information can we provide that organization to make sure that they are hearing stories on the ground of scams and abuse?
Partner with us.
Mhm.
Get us involved. You got our contact information. It doesn't have to be a formal agreement on how we work together. It can be. I might share with you that every once in a while, the Senior Medicare Patrol have the ability to sub-grant to other sister organizations, and we have a formal agreement. And in that formal agreement, you would bring forth those scenarios where people are scammed or defrauded. And ultimately, like I said, they're reported to the investigators, because it's the only way we're going to get those bad guys off the street.
Yeah. So Micki, before we wrap up, I have one last question for you, because I think that sort of prevention is worth, what is it, a pound of cure, and that we are all on the front lines of our own protection. What is one thing that you do to make sure you stay scam free? If you get the scam call to protect your information, what's one little tip that you find useful in your own life?
That's a good question, Nicole. Let me tell you. I tell this all the time. Every time my husband's cell phone rings, I hold my breath. I am petrified that there is somebody who's going to trick him into something. And here is a very lucid, very intelligent gentleman. The FBI did a presentation recently, and these are the two things that stick in my mind. Number one, if you pick up the telephone and you answer the call, even if you don't say anything, you pick up the phone, you are put on a list whereby you will be called again by the scammers. And the second thing, if you engage that scammer or that fraudster, and even if you think you're being funny and you want to keep them on the line and waste their time, no, you get put on another list. And that list says this person engages. Mm-hmm. And let me tell you, these scammers and these fraudsters, they are taught how to deceive people one way or another. They're trained. So I would say never pick up the phone unless you recognize the number, or let them all go to voicemail. If it's an important call, they'll get the message, you can call them back.
Absolutely. Thank you, Micki. I appreciate that. Thank you for all the work that you do and for sharing your wealth of wisdom with our elder justice community here. Before we sign off, I have a couple things to talk to our community about. And the first is actually asking for your assistance. So you may not know that we are a very tiny sort of nonprofit, but we have pioneered a program called the Healthcare Career Pathway. And it's a new way to train caregivers and support them into the allied healthcare field. And it's been very successful in our area at helping to address the critical shortage of certified nursing assistants. And we are trying to make that available to all of our counties across California via a pilot program. And it's being championed in the assembly here in California. And so if you feel so inclined, I've added a link in the chat. If you would check that, go over our materials, and if you're able to, I would invite you to provide a letter of support. And there's a template letter of support in that Google Drive link. And indicate that you or your organization are supportive of the healthcare career pathway and are interested in extending that to the rest of the state. So I ask if you could just take a few minutes and do that. It would mean a lot to our organization, and it would go a long way to helping address the critical shortage of caregivers that we are seeing here in California. Lastly, I want to tell you, we have opened the registration for next month's session, and Christy's going to drop that in the chat. And we are going to be taking on the hard and heartbreaking and probably messy topic of the rise in violence against Asian Americans here in the United States, and particularly its impact on older adults. And so we are going to be here for this conversation. We are still working on some of the details, so I can't tease who the speaker is going to be to you, but I really want to invite you to come back and for us as service providers to engage in some of these hard conversations about how we can best support our clients and understand their experience in the world right now. As always, I want to thank you all for all of the work you do and coming back here and joining us every month. It's been a great community we've built here, and we are excited to continue it and to continue learning along with all of you. So I hope you have a wonderful day, and we look forward to seeing you back here next month. Be sure to click the link and register and reserve your spot. Have a wonderful day.